Dash is a better way to provide health care for seniors because it's easy, it's affordable, and it's quick.
It's very stressful, you know, when you're not feeling well, you have nobody around and you just, who do you call? You call an ambulance.
Have you ever gone to the emergency room? Have you ever gone in there and sat there for 5 or 6 hours until they first came and looked at you? We avoid all that.
A visit to the emergency room for a couple is not only stressful for the one receiving care, but it's also stressful for the spouse that's there with them in that emergency room situation.
Dash is about patient-centered care. It's about delivering the care to seniors that they really want. And for so many of them, what they really want is that care in their home.
It was late in the day, after 5 o'clock. I had an earache that just was progressively getting worse. And I couldn't get the doctor after 5 o'clock. I called Dash immediately. The nurse was there in 30 minutes. Chop, chop, checked me out, called the doctor. The Dash doctor confirmed what she thought was the matter. They told me what to do, and it was great. She was gone. I never got out of my pajamas.
We bring prescription medications with us. We can initiate treatment right there on the spot.
They don't leave until they know you're right, or that you can function. And if they think it's a more serious thing and that you need hospital care or emergency room care, they'll call the ambulance. They'll stay with you till the ambulance comes, and they'll send you off to the hospital.
At Dash, we know how important it is to keep the primary care doctors in the loop. So our protocol is that we communicate to the primary care doctor after every rapid response visit that we do.
Well, being a physician, I'm very well acquainted with the essence of time. And the thing about Dash is that it's fast. It's not only convenient, it can be life-saving. And if it's not life-saving, it's relief of pain promptly.
Dash is coming to the rescue of our seniors in a way that no one else in this community is doing.
We feel so strongly about it. When we interview a new resident, we give the information and request that they sign up for Dash.
For some of the families particularly, they're so worried about how marginally safe their loved ones are at home. When they know that Dash is available to them, they really can rest much easier.
When a Dash nurse comes out, she's looking at their whole environment. Are they taking their medication the way they should be? Where's it stored? Are they eating and drinking enough with their medication? Do they have trip hazards?
We carefully select the doctors and the nurses that we're going to work with. We particularly look for seasoned clinicians, people who've been around for a while, people who've done home care, people who've worked in primary care or even in emergency care.
It's quality care that they're receiving right in the privacy of their own home.
It's such a security for somebody who, especially if you are living alone, and even if you're not living alone, it's wonderful to know somebody's there to help you.
The biggest thing is they care, they know what they're doing, and they want to help you. Me, us.
If you're over 60 and you live in Santa Barbara, you absolutely must register with Dash.
They are like family. And I talk to them like family, I'm afraid.
Dash is the best thing since chopped liver. And if you don't know what chopped liver is, you're in trouble.